approximation of realities. And even with that, you also want to ensure that your model is capturing a better approximation of that realities. And that will now involve the engagement of several functions to capture components of the model of the disease dynamics before you confront that particular model with data. And one of the things that is also very important is the fact that this function, bringing them all together within the model, there must be a kind of coherency such that the mathematical terms have strong coherency with the biological processes. Maybe for instance now, it shouldn't be that, all right, thank you. So it shouldn't be that in your model, you are trying to explain a particular components. What you are dealing with is a complex system. So I'll be taking us through mathematical foundation for infectious disease modeling. And this is just the overview. So I'm just trying to explain this background to us because that is very, very important to come up with a politically relevant model. Because one thing is that when the model is not correct, I can assure you whatever, even because there are cases whereby you may have a wrong model, you feed it to the data, and the model is fitting well to the data. Please, are we together? Yeah, you've come up with the model, but some of the components of the model are wrong. But not knowing that, maybe you went on to see fit it to the data, it may become fitted to the data. You have very nice results and everything, but by the time we begin to review the model, we begin to see some of the components that are wrongly explained, some of the biological components of that particular disease. So that is why it's very, very important that one, as I've said earlier, we understand the biology of the disease and also understand how the functions we are coming up with explain the particular biological processes that we want to capture. And that is why I said the coherency of mathematical terms and biological terms is very crucial for better interpretation or representation of biological processes and other processes within other systems. Let us not forget that what we are looking at is a complex system. And why do we call it complex system? We call it complex system not because it is hard. No. We call it complex system because there are many components that interact together. That's why we call it a complex system, because we have a lot of simple components that come together to become the whole system. And one thing is that each of those components have effects on the other. Why? Because there's a kind of interaction. That's why sometimes, if you look at our body system, we have several components in our body system, isn't it? But they work together in unity. That's why sometimes you may have injuries somewhere it's affecting another organ. Why? Because there's a kind of interaction. So the same thing in our mathematical model. So that's very critical. So these components and their interactions can be captured with mathematical functions and diverse concepts to explain dynamics of different systems. Consequently, appropriate use of mathematical functions to capture components of processes or dynamics of interest is essential to build mathematical models that are representatives of such systems. So I'm going to begin with something simple, and then I'll be giving us also some practical examples so that when you want to develop a model, we always have this at the back of our mind. We always have this question, okay, what I'm coming up with, is it capturing the biological process? And for those of us who are like the stakeholders, malaria managers, and other particular disease managers, individuals, and all of that, sometimes also when modelers are presenting their work, one of the things you also want to be sure of is that they were able to capture the integral parts of the disease dynamics that is of interest for some of the questions we want them to address. So that's very, very key and very, very important. So, whatever model needs to be developed to answer questions of interest. So I'm going to begin with equation of a straight line. It's something simple, y equals to mc plus c, where m is the gradient, t is the independent variable, y is the dependent variable, and c here is just the intercept. So but in biological processes or in mathematical modeling, we will not see directly as y equals to mc plus c. Reason being that the components of interest in that model that we want to capture, if they have names, because we use parameters to explain the dynamics of the disease together with other variables within the model. So for instance now, the where m is the gradient and c is the constant value at which line the line crosses the vertical y-axis, that is s equals to 0. In infectious disease modeling, the mosquito biting rate, for example, so just to align with something we are familiar with, we all know the issue of malaria in Nigeria. Nigeria happens to be the country with the highest volume of malaria all over the world. So I'll be using malaria practically as an example in this particular class. So the mosquito biting rate, for example, can be modeled as a linear function. What we mean is that it can be modeled as something that just have a linear relationship with just a linear behavior, just a straight line. You know, if you remember, if you are plotting our graph, when we have a straight line, just a straight line like this, that is a linear equation, right? Just a linear equation. So, and that is what this equation one is just making us to understand. This beta max represents the maximum mosquito biting rate. The maximum mosquito biting rate. Then this beta mean here represents the minimum mosquito biting rate. And then the B dot here that we are seeing here just represents the proportion of bed nets usage. You know, one of the control intervention or control source to control malaria is the use of bed nets, isn't it? So and now, so what this one is just saying here now is that this bed net here is put there as to regulate the mosquito biting rate, right? You know, when the mosquito is coming to bite and there's a variability to the net, so that's reduce the mosquito biting rate. So that's what this one is just. It's just going into that place. All right. So and this equation one here is just a linear equation. It's just a linear equation. In that our B here now, which is the B naught, our B naught here is like the independent variable, just serving the position of T in this case. That's why we say that the biting rate is a function of the net usage. Can we see that now? It's a function of the net usage. So it's not just a linear relationship between the biting rate and also the bed net usage. So if we see the next slide, the next slide shows us that relationship as we can see. So this is just to show us a pictorial form of that relationship. But you can see it's just a straight line, isn't it? But now one of the things you want to see here is that is a kind of the straight line is a negative one in that the mosquito biting rate decreases as the bed net usage increases, right? So you will see just like what my colleague just mentioned with us. When we look at the relationship between rainfall and the cases, we said they have a kind of positive correlation, isn't it? And what does that mean? As though as one increase, this one also increase, isn't it? But this one here now is a kind of negative in that as one increase, the other one decreases. So now, what you are just showing here now is that you have used a linear equation to capture the relationship between the mosquito biting rate as a function of bed net usage, right? So maybe your malaria problem, if this is what you want to do, so what you got to do is that for the mosquito biting rate, all right, for the mosquito biting rate, as a function of the bed net usage, you make it of this function. But one of the things we also need to know is the fact that every function we want to use is also based on some assumptions. But of those functions also they have their limitations. All right. Knowing that the world itself is complex and we want to be simple as much as possible, but not simpler. All right. So whatever function you also want to use, want to ensure that it also captures some level of reality, right? So that's that about that. So like this one right now, this linear one, it has its own limitation. It has its own limitation. Reason being that the mosquito biting rate is not always linear, just like we have seen it in this. All right, it's not always linear. We are still going to see one time in that's in the next slide. So we have other types of function. So now one thing is before we do anything, just like I said, it's very important to understand the biology of the particular disease. And also, it's also important that we have a proper understanding of our data. Two things I've mentioned. The biology of the what? And what's the second thing? Of our data. It's very important. It's very important. Because one of the things you want to do with your model is that you have the data with maybe the number of cases maybe per month, like my colleague just showed us, right? But there are things that have gone on outside the scene, behind the scene to produce that, isn't it? So you are using your model to represent what has gone on at the background, all right, to produce the cases, and that is the transmission dynamics to produce the cases. So you want to ensure that your model having been able to capture the transmission dynamics, you also want to ensure that your model is able to reproduce the data. Not exactly, are you getting it now? If you're not you're not to get it exactly, but you have something close to the data. Reason being that, just like the confirmation when it was taking us in the one, you can't capture everything with a single model. Are you getting it now? You can't capture everything with a single model. But what you want to do is that you want to capture as much as possible, and that is also realistic in order to explain the particular data. So we have other types of function. So one of them is the trigonometric function where we have sin x, cos s, tan s. For small person, we still remember I practice that always so catwa. Do you remember so catwa? Right? Okay, so for trigonometric function, so catwa. So where we have our f of x is the y, which are the dependent variables, and the x are the independent variables. So the dependent variable can be a process in a system that is dependent on other variables. Suppose the dependent variable is sin t, all right, so we have f of t to be equal to sin t. If our independent variable is t, that is maybe what we are looking at is a function of time, all right, so that is dependent on time, right? So we can make it a function of. So we also have polynomial functions. A typical example is the quadratic equation. If you remember what we call almighty formula. How many of us remember that formula? Almighty formula, even though there's nothing almighty about it. You know, as far as secondary school days are concerned, that was like the big equation we have seen. So we call this almighty formula. Only for us to get to university and discover that what we call almighty is not even almighty in the first place. Right? So so the quadratic equation or any perfect naturally coming from the polynomial function. And these are very, very important. These are very, very important because there are some components of the fluid dynamics or transport dynamics that are unimodal in the sense that at a particular range of their dependent variables, independent variables, they reach their peak. Let's say for example, I will use typically usually region with then I will go come back on. For example, if you are selling chicken, you agree with me that chicken sales during December, isn't it? So you agree with me now that along the year you will be having some sales. Are you getting it now? But it's supposed to be a very long thing. But as you get to around December, what do you experience? You experience a peak. And after that, what do you experience again? Are you getting it now? So you will now see that it's like within that year you have a single peak, right? Which says function like having something like that, we call them the modal functions. Are we there? As if they have one node, one peak. Are you getting it now? We have some functions may have two peaks That is binodal. Are you getting it now? Well, maybe for example, if you want to consider the chicken again, maybe during Easter, maybe we say Easter also may have some pig, December may have some pig. Are you getting it now? That means within the year we may have many pigs, 2 pigs. That is binodal. Are you getting it now? So sometimes you see disease also have that kind of behavior. Please, are we following? You have when you look at when you study the data, you are seeing that the data is also exhibiting a behavior like that. Maybe within a year you have a single peak, or within a year you have more than a peak. Maybe you have 2 peaks, and there are times that it cannot be within the year. It may be every 3 years, every 2 years you are experiencing some peaks, and you want your model to also capture that. All right. So sometimes for malaria, maybe within the year, we call it seasonality of malaria. Malaria is seasonal, isn't it? And like in the northern states, it is highly seasonal. It's highly seasonal in the northern states. So sometimes you want to capture all of these things. So the trigonometric functions can help us in a way to capture it. They are building blocks to capture that. And then some inherent behavior, maybe of mosquitoes, we can capture that with the quadratic function. So you will see that everything we are seeing here, they are useful. Please, are we together? So they are useful, but one thing you need to know is that, okay, how is the behavior like? Are we together now? Can this function capture it? Very, very important. Very, very important. Okay, so then we want to explicitly look at function of time. So the equation y equals to f of t represents a function of time. That means that function is dependent on time. That process is dependent on time. And this is very important for us in modeling. Parameters are key parts of mathematical models. Reason being that they give appropriate explanation for the transmission dynamics of infectious disease captured with deterministic models. Parameters are very important. Just like Prof challenged us one day, he asked us a question. We have mosquito-borne diseases. For instance, now malaria is mosquito-borne, right? Then we also have dengue. Dengue is also mosquito-borne, right? And some other diseases like that. So he asked us that what's the difference between if you have the model of dengue and the model of malaria? Then he made us to realize that what differentiates them is their parameters. Their parameters. If you look at them, they are both the same. Why? For they are both mosquito-borne diseases, right? But their parameters are in a way or the other different. So sometimes we are told that, oh, this one is for malaria, oh, this one is for dengue. I really get it now. So I'm just trying to tell us the importance of parameters in our models, right? And these parameters can either be constant or time dependent. They can either be what? Or very important, constant or time dependent. So let's take a look at this model that have this social condition. This particular one now, the parameters where we have the beta, we have the gamma. Are we there? These capital R's, I, and I also have the state variables. Okay, so it's just like you have a population that you have command people 3. You are susceptible, you have the infectious, you have the recovered, correct? So these are the letter S, I, and R. But the beta, here now, this one can be the transmission rates, right? And then you have the gamma, which is like the recovery rate. Are you getting it now? So in this case now, the beta and the gamma are constants. They are constants. And the nature of the parameters help us to know the type of model that we have. Because we have autonomous model and non-autonomous model. Can we measure this? Yes. So for autonomous model, their parameters are not explicitly dependent on that. They have constant parameters. Those are autonomous model. So like this case now, this one is an autonomous model. One, the parameters beta and gamma are not dependent on time. Please, are we together? They're just constant. That means, for example, now if this beta is let's say 0.5 and this gamma is 0.2, for instance, it means across time it will be 0.5, 0.2. Are we together? Across time, they are constant. Across time, it will be 0.5, 0.2. And that makes this system to be an autonomous system. But if one of them is dependent on time, explicitly dependent on time, are we there? Then we have non-autonomous model. What do I call it? Non-autonomous model. That means one of them is explicitly dependent on time. And what that will mean is that at different points in time, the value of that parameter will be different. Are we together? Are we together? It's going to be different, okay? So let's move on. So I want to give us a typical example. A typical example. It's okay. All right. All right. So for the time dependent parameters, so I want to use the biting rate still, okay, to explain. No, the other time you are with me that we have the biting rate as a function of dependent usage, isn't it? Right? But now we want to define it as a function of time. Reason being that the biting rate is not constant. Are we together? The mosquito biting rate is not constant. It depends on several factors. Okay? So it's not constant. So severity of malaria represents observed systematic peaks of malaria cases. I think I mentioned this earlier. And this can be semi-annual. This semi-annual means you'll be seeing like 2 peaks within a year. It can be annual, where you have the same peak within a year. You can have multi-annual, all right? Maybe every 2 years, every 3 years, you are seeing a peak, all right? You know, and combination of these cycles, in some cases, you can have all the three. In some cases, you can have all the three. You can have, and that's very important for malaria managers or program managers. Very, very important. Because all of these they have implications for the deployment of control intervention. Very, very important. In this way, you have 2 peaks of malaria within a year. You know, the control intervention we are deploying, we want to know which peak is able to capture. Is it the first or second or both? Are we together now? So it's very, very important. So environmental and climatic factors, among other factors, are responsible for severity of malaria. And this factor influences the availability of conditions suitable for the sustainability of mosquito population and their activities, e.g., biting of blood, right? Right. So this navigation can be integrated into malaria model through mosquito biting rates. We have several means through that can be done, all right? But one of it is just the mosquito biting rate because there are several processes of the dynamics of the mosquito, all right? So but we are only, for example's sake, I'm just considering the mosquito biting rate. So the mosquito biting rate is a function of time. We have the B naught, which is like the baseline mosquito biting rate, all right? Maybe let's say 0.5. All right, so into bracket 1 plus BA, which is the amplitude, then sine 2 pi over P, which is the period, T minus 5, which is the phase angle. All right, everything you are seeing here, they have what they do. Are you getting this now? Every component you see here, they have what they mean. I'll just briefly describe some of them before we go through. Before we go to the next, I think we are going to be stopping here. Right, so we are going to stopping here, but let me just quickly some few things here, so that we can see the beauty of mathematics in capturing some of these things. Okay, so now this is the baseline mosquito biting rate. All right, so this P here, you know, I told us the other time that the slightly can be semi-annual, annual, multi-annual, isn't it? Or combination. So we have seen several papers, they just assume this speed will be 12. You know, the other time Prof was saying that you will see some papers, they will tell you that as this one is going down. With what data are you saying that? What is going down? It may go down in model, but it's not going down in reality. Why? Because you have not captured the reality. All right. So because we have seen cases whereby the periodicity of malaria within a year is not just annual, it's not just a single peak. All right. And if you have more than a single peak, this one may not really work. But let's just say we're just going to stick with this. So let's assume that we have maybe an annual cycle where we experience just a single peak within a year. Our period becomes 12. Are we there? Because we experience it annually. We experience just a single peak annually. Our period, that's the periodicity, it becomes 12. So this one here, which is the 5, is just making us to fit the timing of the peak. Please, are we together? Because the timing of the peak, for instance, now, like in Zamfara State, we experience peak of malaria cases in August. Are we there? And some places maybe before August or after August, as the case may be. So we want to use this part as to capture that. So now, if we plot this function, we are going to have this nominal behavior as we see here. Are we seeing that? You will agree with that the former one we just saw a straight line, isn't it? But this one now we are seeing something that captures a more realistic behavior. In that, what this one is just saying is that at some point in the year, we have more biting rates of the mosquitoes. Are you getting it now? And at some point within the year, we have the very low mosquito biting rates. Are you getting it now? Depending on some conditions. Although in this place now, we have not factored in this place. What we have just done in this place is just a kind of implicit representation of the mosquito biting rates. Implicit. Reason being that there are drivers of the mosquito bite rates. For example, temperature drives mosquito bite rates. Are you getting it now? So, but we have not incorporated that into this place. So, this one is just a kind of an approximated way of representing the mosquito bite rate without including the driver itself. Okay? And that is what gave us this particular behavior. And we now see that this is the kind of behavior we also see in our familiar cases data. So we want to also be able to ensure that, okay, the kind of behavior we're also seeing model is also able to really capture that. I think I'm going to stop here for now. Maybe it's time for me to next class. Thank you. Can we ask now, I just thought of what this and I was wondering that I need to there's a principle equation that will relate the mathematics. Yeah, the one day this is talking about anything and they're talking about vaccine they are talking. It's that's why Prof said it's not our regulars, right? It's in how you can bring out meaning. You can clearly read out something. You are how many times have you been with Hosanna and talking? We have that in the times, but have you ever felt that you can do something? So essentially, careful listening. Careful listening. The simple thing, how do we bring out a lot of very why then wasting away because there's not going to carefully think of its usage. Right? And so before we are here. And by the time you see mass already come up with form of the mathematical frame, and then all these things are used to grab sheets, and then we'll bring the data with it. We just be smiling. You see some very nice pictures. Very nice results. And that's all the people are asking for. Yeah, you just want to know how they can compose some things and then get some results. All right, so let me put allow us to ask questions. For me, I was very I was thinking that I was looking at me in the world. It's very good. So now let's ask question 1 or 2 before we move. Because Prof is going to take us the last class now, and then move forward which we want from there. Okay. So I think 1 is okay. Let's have we have 3 money. Okay, you also have the question. So let's just have this. Okay, thank you. Please help me with the this. All right. So for the online participants, please, if you have a question,
let's know so that we can respond to your question. I think somebody I'm seeing something. And you will. Oh, sorry, it was my station. That was one of.